Welcome. Happy Tuesday, folks. Great to have you in today's Washington State-sponsored Cultural Responsiveness Learning Community. Today, um, presented by the Washington Healthcare Authority in conjunction with the Rutgers um, Department of Psychiatric Rehabilitation and Counseling Professions. We are going to be having a wonderful presentation on addressing implicit bias from awareness to conscious decision making. As noted, the session is being recorded, and today's presenter, I'm so excited to have him here today, is Earl Leach. He is a senior training and consultation specialist at Rutgers School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. Earl provides in-person and remote training, consultation, and technical assistance to community support services providers in New Jersey throughout the state. He also provides training to mental health providers in Washington. Earl has more than 25 years of experience in service provision, management, administration, and behavioral health services in organizations in New York, New Jersey, Virginia, and Massachusetts. So Earl is coming today with a wealth of knowledge. Prior to joining Rutgers, he served as a regional director for mental health residential services for a private nonprofit behavioral health care organization in New Jersey and worked collaboratively with county mental health boards and local professional advisory committees on alcohol and drug use in the northern region of New Jersey. Earl, it is so great to have you today.
Thank you, Amy. Thanks for the introduction. I hope I do that introduction justice. But as is always, it's quite a delight to join you, folks in Washington. And happy Tuesday and good evening. So today we are going to focus on addressing implicit bias, and we're going to really focus on the process from awareness to conscious decision making in terms of addressing implicit bias and its potential impact across both our personal and our professional lives. This is certainly a subject matter that garners a tremendous amount of interest, and certainly, and I want to give a heads up, this is a subject matter that oftentimes can really delve into a tremendous amount of unconscious issues and challenges that really make up and encompass our entire being. So please feel free to share your perspectives, and we will talk some more about the concept of really recognizing and adhering to the safe space and having the freedom to really discuss in a respectful yet comprehensive manner. So look forward to a really active and meaningful discussion. So what's important is for us to certainly establish clearly what our ground rules are, what our guidance should be for the engagement today. We want to remind you that this is a knowledge and share and safe space for you to share your knowledge. We believe in the concept of co-learning, and everyone here has a different experience and expertise, and we want folks to bring that to bear, and certainly for it to be received and respected in a manner that is going to certainly allow us to all learn and grow and evolve from this sharing of information. We want to maintain that respectful framework and understand that clearly we all hold different identities, and that certainly brings a tremendous amount of beauty and diversity to the process. We want you to be present and engaged and to lead with curiosity and certainly demonstrate your willingness to recognize differences and certainly engage in that process of discourse. So this webinar is a stigma-free zone, and we expect people to respect that. And my goal today is to really facilitate the space for everyone to share, learn, and ask questions. So we leave here with some meaningful and tangible takeaway and an understanding that certainly each and every one of us certainly brings a different perspective even to the same subject matter. The Washington State Cultural Responsiveness Series, this is the second in that series. In November, we had our initial session with cultural humility, and today we're certainly focusing on implicit bias. This will be followed by our March session. It's really focused on supporting individuals with mental health conditions and autism spectrum disorder. And as you can see, a list of additional sessions, and we hope that you take the opportunity to join us and really get a full and all-encompassing perspective of the cultural responsiveness series. So please certainly take the opportunity to join us in the future. So today, what do we intend to share? What do we intend to take away from today? We want to make sure that folks leave here with today with a sense of recognition of implicit bias and why it matters. We want to be able to help you and facilitate that process of identifying sources of implicit biases. We want to recognize the extensive and profound impact of implicit bias in both our personal and professional settings. And ultimately, and finally, we want to make sure that you are able to describe strategies to not only increase your awareness of implicit bias, but to use the conscious decision-making process to change behavior accordingly as you become more and more aware of your own implicit bias and its impact. So that's our framework, that's our goal, that's what we intend to pursue today. And I certainly hope that we were able to garner that and gain that at the end of a session today. And we'll check in just to make sure that folks are getting what is intended here and keeping us all accountable for today's activities. So it's important for us to start with that whole comprehensive framework. And certainly a good place to start is to really look at what is cultural identity? How do we, both individually and collectively, define that and create a framework for that? So the first question I'd like to ask, and I would love you to share your perspective, is what is your working definition of cultural and cultural identities? And certainly, there's no right and wrong perspective about it. I certainly want to gain yours. So please feel free to share in the chat if you have a working perspective, a working definition of culture and cultural identities. I'll certainly be happy if you can share that. And I know it's quite early to ask you to delve into your bags of definition, but if you have the opportunity, certainly do so.
We have some things coming in, Earl, from Marissa. My basic definition, a sense of belonging to a specific culture.
Fantastic. And thank you for sharing, Marissa. That is certainly poignant.
The
Anyone else?
From Valerie, culture may be the mores and norms in a population or area.
That's fantastic, Valerie. I want to commend you. I haven't heard that term used quite often, and I come from a background where that is oftentimes used, that mores and norms. But that certainly lends itself to a good conceptualization of cultural identity.
A lot more coming in. We have culture equals framework,
Okay.
a group-derived idea of what it means to be one of the group.
And I think we're all kind of honing in on a good perspective, a good working definition. So as usual, folks from Washington are on target, spot on, and really honing in on where we want to go. So in the interest of time, I'm going to give you the perspective that we often use. And that certainly is one of the most basic definition of cultural identity, is that sense of belonging, of connection to a group with a shared lived experience or shared faction of that identity. So it's really about how do you identify, how do you find that sense of collectiveness, that sense of togetherness, that sense of mutual or total concept of who we are and how we see ourselves in our the space that we certainly exist in. So we hold, what's also important to note is that we hold a multitude of identities simultaneously. And that's one of the things that is important to note. Even if we have a specific concept of our most profound sense of how we identify, it's important for us to also note that we have a multitude of identities that are occurring simultaneously. And those identities carry points of privilege and points of oppression. So oftentimes we may not see that duality, that sense of two different zones of our cultural identity. But it's important for us to note that. It really speaks to that congruence or incongruence of one's identity to the dominant cultural groups. Even if you belong to that group, you can, in different ways, have incongruence or congruence with that identity. And I'll give you an example. And one that I often think of is, I look at myself and I identify as certainly a Black man, a Black straight man. And in many instances, in my homogeneous group, there is a privilege of being both male and certainly a man, a person of color. And at the same time, I also identify as a straight man wearing certain concepts in certain environments. I may also find that to be a privileged status, or in some instances, it may certainly be as a Black man, I may certainly have also identify with being in an oppressive state at different points. So that's what I'm referring to when we speak of that duality or that conglomeration of identities that may have both a congruence or incongruence with an oppressive state or a state of privilege simultaneously. And I hope that frames the concept of that collective identity and that identity that also has that variance. Precisely, Alex, that intersectionality, and that's certainly the phrase that we coin often that speaks to that duality. And that's important to note. We also want to make sure that we're looking at building that cultural responsiveness as we identify both as a person that is specific to that group and our intersectionality. We also want to look at that concept of building cultural responsiveness. And it's particularly in the context of behavioral health services. We want to make sure we have an understanding about the combination of cultural variables, of the full range of dimensions of diversity for everyone who work in our service. Because as we work with folks and we provide service, we see they bring their own complexity, intersectionality, and identity as it relates to their cultural sense of who they are. And it's important for us as well as we work in this field, as we grow and we evolve in this field, we have a sense of cultural responsiveness that really requires fundamentally valuing diversity and seeking to further expand our cultural knowledge, working towards the creation of a community space and spaces where diversity is valued. So it's important for us to recognize both our right to experience that and to pursue that, as well as our responsibility to contribute to that environment, being one that defines and really speaks and facilitates to cultural responsiveness and building an environment where cultural responsiveness is regarded and recognized. And we live that mantra. And Peter, I see you indicate clearly that cultural identity to me is someone who represents himself to a specific group, and we spoke about that global cultural identity as well as the intersectionality and our responsibility and pursuit, continuous pursuit of cultural responsiveness in our role in this particular field. So I hope that sets up a good framework, not only for us to identify that we're coming into this as ever growing and evolving and learning participants, but as well as our responsibility on a professional level to ensure that we're facilitating and we're creating and contributing to an environment that's responsive to that cultural identity. So, a little shift. I want to get back on track and focus on our objectives and goals for today. And we want to really speak to what is implicit bias and what it looks like, what it means to us, why is it important? And I want to start off with a little tickler, a little way of getting your minds to get to work. So I want you to think from these images that I present on the screen, what is your initial association? What initial association do you make with these images? And I'm going to give you 10 seconds and ask you to then respond with your initial thought.
We have a lot coming in the chat.
I know, and it's going to come fast and quick, but okay, so we're at 10 seconds. So if you haven't already, pause for a moment. I want you to think about your responses. And I'm going to try to get to some of them quickly. And this is fantastic. You guys are definitely stirring the pot here, right? Youth, young adults, honor students, spelling bee winners, happy kids, mic'd up. I never thought of that. Diversity, youthfulness, happiness. So the main focus here, I see kind of three main themes: youthfulness, happiness with the faces, and certainly it appears as though there is some concept of kids who are studious or thoughtful. Now, I'm going to even ask you to think a little further. Now, my first thought here is fantastic. You're brave enough to give your first impression. But I'm going to ask you now, what if I told you that there's more in common with each one of these individuals shown here than simply being people of color or BIPOC, right? Black, indigenous, or other people of color. There's more to them than their appearance. They're phenotypical, they're genetic appearance. What if I told you that there were more than that? What if I told you that each one of these individuals presented here, shown here, were actually part of a collection of some of the youngest people in America and across the world to have earned doctorate or PhD degrees? Would that change your perspective? And Jody says, whoa, I had that same reaction. Smart kids, impressive beyond their age. What if I told you that one of them had earned a Guinness World Record for becoming the youngest doctor in the United States and in the world? What I'm going to ask you to think of is, which one of them do you think earned that title? Just looking at the picture. I see it. Someone said the girl. Someone said the middle kid. The middle kid. The center picture. You can tell by their smiles that they're empowered. I love it. Kid on the right, the red shirt. Someone who said the middle kid, and I'm going to ask you, I'm going to ask you to indulge here. Why do you say the middle kid? Or if I told you it certainly was the middle kid, what made you think that? Ah, someone said bias. Someone said he looks the youngest. Shirt and tie. The dress shirt. He got a side profile. You guys are taking it way out there. He has the doctor look. I never thought about that. Phenomenal. So you're brave, you're joining it. So let me do you a favor and tell you, first of all, the first photo of the young lady is Dr. Dorothy Jane Tillman II, and she earned her doctorate in integrated behavioral health from Arizona State at age 17. Phenomenal feat. And she was homeschooled by her mom. And she had a master's at age 14. We're all slumming when it comes to her. Kid in the middle, Dr. Bulamari Ambati is the youngest doctor in the United States in the world. He earned the Guinness World Record for the title in 1995. He graduated from Mount Sinai School of Medicine in New York City at the age of 17. And the kid on the far right, Dr. Carlson Hugh, is a Texas Christian youngest person to earn a PhD, becoming the youngest doctoral student in the school's history. And he was at age 21, PhD in physics. Phenomenal feat. Prodigies, absolutely, Katie. Now, someone mentioned something significant. His shirt and tie, his side profile. We came up with all kinds of different perspectives as to why he was the person who won the Guinness Book of World Record for that. Now, I'm going to ask you again, would these images have changed your association? If you look at them dressed the way they do, presented the way they do, would that have changed your initial association? I see a lot of no, maybe, not so much. Yes, yep, yes, maybe. The black and white photo would have made me think it was taken years ago. Ah, we have some smart folks here. Absolutely. The formal headshot would maybe change it. Might have learned more towards the girl as a doctor, leans towards the girl. They look older. Absolutely. So most of those comments that you speak to are logical and accurate in the sense that sometimes our initial perspective can be changed by a shift in merely a presentation, a perspective, a dress. There's lots that really informs our thought, our initial thought, our categorization, and we'll speak some more to that as we get more into this subject matter. But thank you for indulging me. I want you to start that process of thinking about how our perspective, our initial conceptualization of things can be influenced by so much. And as we know for a fact, and someone mentioned, a lot of this can be, in many ways, a way of connecting to our own biases. And it's important for us to have a concept of our own biases and what that means. What is bias altogether, right? It's simply that tendency and that inclination or prejudice towards something or someone. And sometimes we don't even know that we are actually exuding that or we're thinking that, we're processing in that manner. But bias is omnipresent, bias is pervasive, and we'll speak some more about a specific kind of bias that really informs and oftentimes can even cloud or modify our way of perceiving people, things, circumstances. And yes, DJ, they can be positive or negative in many regards. So it's important for us to, first of all, recognize bias is real, bias is present, and we contend with it every day in our lives. But we want to drill down more into what is implicit bias. that form of bias. And why is it important? We'll talk some more about specifically what that is. So can anyone tell me, what do you understand by the term implicit bias? And Brandon says, without thinking. Pre-consciousness. And Katie says, assumptions we make automatically, unintentional. Judgment without thinking or without cause. And we'll learn that a lot of this, yes, initially is a good framework, but it's even more than that. It's deeper. And Kirsten says it may pass down from through generations, teaching automatic responses, judgment without care. Sometimes it's not necessarily without care, but oftentimes it's without conscious filter or framework. And as is usual, you are narrowing it down. So an implicit bias, often also referred to as unconscious bias or implicit social cognition, really refers to positive or negative mental attitudes towards a person, things, or group that a person is unaware of having. And these so-called attitudes or stereotypes unconsciously affect understanding, decisions, and actions. And as we speak some more to it, we'll see how pervasive and profound and impactful it is in a lot of the decisions we make, both initially, intuitively, and oftentimes even when we think differently or we propose to think differently, those unconscious processes oftentimes significantly influence the way we behave, we think, and we perceive things. And Tony, spot on. Both positive and negative experience with various individuals can also influence attitudes and actions, and we'll talk about how they do so. So what I want to do is take an opportunity to jump into a way, I think, in my opinion, this is the best framework, the best definition or description I have of implicit bias, how it's explained. And this is Dr. Banaji, who is a professor of psychology at Harvard University, as a pioneer in the research in implicit bias. And she really defines or explains implicit bias in a way that I think it's easy to understand and really is salient and profound. So let me make sure that I am sharing my sound because I want to make sure that we are hearing. So bear with me one moment. And my apologies, I'll get right to it. So let me make sure that we're hearing.
The video is not playing for us, Earl.
All right, one moment. Sorry. Here we go. Okay. Let's try that again.
Yes.
Plymouth Rock, I never wonder if I'm covered for home and auto.
Yep.
more
You're
savings, more.
So the
Right.
work that I have been doing for the last, close to 40 years now, is work on trying to get at the implicit or the unconscious or the less visible, even to ourselves, contents of our minds. We've developed tests like the IAT or the implicit association test, which we use to bypass, to get away from asking people what they might think or feel, and instead just trying to see what might be in their minds. So we might look, for example, at how rapidly or how quickly or how accurately you can put two things together. And the test will reveal, in a sense, what it is that might be sitting in your mind that you may not know about. So I'll give you an example just with me. I am a woman. I have worked outside the home all my life. And yet, when I take a test that requires me to associate female with career and male with home, I can't seem to do that as well as if you gave me the opposite. If you ask me to associate female with home and male with career, that turns out to be relatively easy for my brain to do. Why? I don't have this belief that women don't belong in the workplace or anything like that, and yet my brain contains the thumbprint of the culture in which I live. And that culture has repeatedly associated female and home more so than male and home, and that's now in my head. That's the important discovery, that we can say consciously, we can say explicitly what we think and feel. That's one way in which our minds work, but there is another part of our mind where these associations that are picked up, sucked out of the culture and sit there, they're there all the time. Where do they come from? One of the things that we've been very interested in is looking at young children. How do young children come to have the beliefs and attitudes that they do? Do they learn it slowly as they grow up and so on? And our data suggests no, that children are very open to what's going on in their culture. And at a very early age, at ages like 2 and 3, we can see evidence that they have in their minds attitudes and stereotypes of the sort we see in adults. So what we now know is that these are picked up pretty quickly, and that they exist in the minds of children even at that age.
And like I said, that spoke to me in a way that I haven't heard implicit bias explained before. And it really left a significant frame in my head and really helped me understand when Dr. Banaji spoke about even we don't fully understand those processes going on in our brain that yet informs the way we filter and categorize things as we see them and we experience them. And that speaks to an implicit bias, an unconscious bias that informs even our decision making and perspective about things. And I hope that that lends some clarity about what it means when we speak of implicit bias. Does that make sense to everyone? Is that framework or that definition, that way of explaining it, easy to understand?
Yeah, we do have some things coming in the chat. A lot of acknowledgments. Yes, very good. Definitely love this.
Fantastic. Because one of the things that I made sure that I took some time to do is to really recognize my own implicit bias, that I am not hearing it from someone that I understand clearly, without really checking in with others to make sure that the same understanding is shared. So glad to hear that it allowed you to have the same understanding as to what implicit bias means. And I think what's also important is the fact that it's unconscious and pervasive and impactful, and yet it can occur at an early age. We develop it so early. And so much of our culture and what we hear and what we see and what we experience informs those processes, yet they're occurring in a region of our brain that we don't fully necessarily have explicitly shown to us. So it's a challenging perspective, but yet one, when fully understood or clearly understood, really makes sense as to how we operate in the world. But I would certainly encourage you, Dr. Banaji has a lot of great work around implicit bias. One is certainly a reference that a book that she created, and we'll speak to that a little later. I'll make sure you have that reference. So what are the characteristics of implicit bias? Because I think she alluded certainly to a lot of different features of implicit bias that is important to inform our own concept of how we operate. So those unconscious, involuntary, and pervasive attitudes, right, can both be favorable and unfavorable. What is important to note as well is that they can be malleable. They're subject to change. Even though it may be difficult to do, it is certainly viable. And we can do that through some work around unlearning and through debiasing techniques. And we'll talk some more about what that looks like. So what's important to note about implicit bias is that it's unconscious, right? They're activated without conscious control. They're pervasive in that they are robust. They really have a strong frame of reference in our minds, and they affect everyone, even people who strive to be impartial. And you'll hear this particular motto, this particular focus. Even in our best attempt to be impartial, even if we perceive ourselves as impartial and egalitarian in our approach, we still have implicit bias that we have to be conscious of, and we have to marshal to ensure that our perception of ourselves and our behavior are aligned. So it's important to recognize. And I love that, DJ. I didn't think about that for a moment. I believe animals develop these two from their life experiences, DJ. And I agree, because they certainly have either an affinity or sometimes an avoidance for certain things given experience. It's important to note as well that it's amenable, right? It's malleable. Implicit bias can be unlearned through practicing certain debiasing techniques. It can be favorable or unfavorable. We can have unconscious cognition that speaks to a favorable perspective about people or things. We also have that perspective of unfavorable experiences or perspective about things given our experiences. So things can be skewed toward either a favorable or unfavorable assessment, given our experiences and how we categorize those experiences, how we frame them, the filter we use. They can be activated by the environment. Even before a person consciously endorses them, it can occur. If we are in a specific environment where we may have had a certain experience, favorable or unfavorable, it is not uncommon for us to have an implicit bias about that particular experience in that particular environment. And it can be persistent even when we reject them. Even when we consciously think and perceive ourselves as having a different perspective and perception or conceptualization of things, implicit bias can pervasively still be in that background. It can persist even when we explicitly reject them. What is critical to understand and to appreciate is that implicit associations that we have may not necessarily align with our declared beliefs or reflect the stances we explicitly endorse. We've had a number of people and circumstances who believe, honestly and explicitly espouse to the public or to people that they care about to know, that they have no known bias towards people who may be of a certain weight. And yet, certain decisions and perceptions may speak to an odd with that express perspective. I don't know if any of you have had that experience of someone saying something concretely about a way they perceive a person or thing, and other behaviors or decisions that they make is contradictory to that voiced perspective. Has that been your experience ever? And Allison says all the time, I've had, yes, it is more common than not. So there's full agreement. I know, I was waiting on that one. Someone said in politics all the time. Analysis says there's a difference between what the mouth is saying and what the, absolutely. So there's some clear and definitive characteristics of implicit bias that we need to be aware of. And there's certainly a distinction between explicit bias and implicit bias. There's a certain distinction there, and it's important for us to know. Explicit bias are those consciously held concepts, right? We volitionally activate them, right? They're overt, they're easy to measure, they're deliberate discriminations when we act in a way that is definitive and clear that we do not have an affinity, liking, or a positive perspective about something, or the reverse, when we explicitly express a prejudice or a distinction about a group, thing, or person that is made clear to everyone. Whereas implicit bias is more unconscious. It's oftentimes difficult to counter with logic. It's difficult to measure, and it's more widely prevalent. So it's important to recognize the distinction between explicit and implicit bias as you proceed. And Sabrina says, I see a lot with providers regarding the housing first model, but pressure people into recovery. Absolutely. There are a number of folks who say quite clearly in their daily engagement with clients or with colleagues, I do not discriminate against people who are homeless, but in the same vein, their decision may demonstrate that they don't think that someone who has a particular condition or have a particular history. Let's give it a clear example. I don't want to just be ambiguous. I want to be clear. Someone may be able to say or may say, I hold no known discrimination against people who are in pursuit of housing or who may be homeless or at risk of homelessness. But implicitly, they may have some prejudice towards people who have had a long history of substance use and don't think that they're deserving. They think someone else who doesn't have substance use should have the first crack at the housing. Or someone who has a history of eviction should not be given the first crack, right? There's lots of different variations of those implicit bias coming out, even though the person is overtly expressing no particular known discrimination or prejudice in their actions. So the distinction is important. So what's the science behind the implicit bias? Because it's important for us to understand clearly, how does that really manifest? Why does that happen? The science really suggests that our brains naturally form associations between social categories, whether it's race, gender, people of a specific nationality. Our brains naturally do that for its own benefit. And specific characteristics based on our experiences and social environment, leading to automatic and often unconscious judgment and behaviors that can be biased even if we don't consciously hold those beliefs. Important element to recognize. Those automatic categorization perceptions can be held even if we don't consciously hold those beliefs. It's a cognitive shortcut, essentially, where the brain relies on learned patterns to make quick decisions, sometimes resulting in prejudice, actions without awareness. So it's our brain's way of shortcutting to get to expedient decision making. It often leads us to have a filter that can be skewed. And sometimes that skewed perspective can actually result in prejudice, discrimination, and oppression, and oftentimes microaggressions. And Mamadou asks, is it true nature? It's a combination of nurture nature. Naturally, as human beings, our brain is conditioned, our brain is designed to help us filter out stuff for protection, for existence, for discerning what works, what doesn't work, who we like, we don't like. That's natural. But then also conditioning, social environment, social information. What we learn from our parents, from our culture, from the media, also informs our consciousness to make those discerning, make those distinctions, to help us make decisions in an expeditious manner. So it's a combination, certainly. There are three stages, psychological stages of implicit bias that is important for us to understand, so we have a sense of how those implicit unconscious thoughts can inform our decision making and actions. So those stages, and go ahead.
We do have a question from DJ about the functional, useful purpose of that process. Why do we do that in terms of the implicit bias?
Great question. Once again, our brain is basically conditioned and trained to make those kinds of formulation, those kinds of distinctions from safety to simply operating in a world that has so much data and information coming at us, right? We have to figure out a way to make those distinctions and determinations, the process to engage, to socialize, oftentimes to safeguard ourselves. What is important is that at some point we have to recognize that those automatic processes can also still be informed by checking, fact checking, consciously making sure that our first thought is not necessarily the only one we use. We have to process it to determine whether it's accurate, whether it's true, it's based on information, based on data, and is not necessarily simply an automatic reaction. Because oftentimes what we find out is that it can be skewed and wrong and inaccurate and oftentimes prejudicial and creates the formation of stereotypes and can lead to discriminative behavior. And Kristen has it profound. There's so much information our brain processes all the time, right? It requires that kind of filtering to help us really put information in categories that we can store and also we can access. So it's a natural automated process that we have to figure out a way to better inform as we become more experienced with our automatic thoughts. And Angela said, it pauses and brings awareness to one's own thought process is correct. Absolutely. It is about taking that pause to process what comes naturally to figure out whether or not it's informed in a manner that allows us to operate in an informed manner. So it's important to know the psychological stages of implicit bias because it's not simply innocuous in all ways, right? It can be harmful if not checked and addressed in a way that allows us to really determine whether or not it's based on information that is both salient, it's informed, and it's impactful in a way that allows us to operate in an informed state. So what are some of the types of implicit biases? Because it's easy to say what it is conceptually, but it's important for us to be able to see it in action and know what it looks like when we see it. So there's affinity bias, right? That feeling that connection to something that's similar. We all develop affinity to specific things that operates in our space. It's classic. If we are naturally, I think of myself, I'm a person that loves food. My natural inclination is to actually engage and socialize with people who have similar interests. And therefore, I oftentimes practice, consciously or unconsciously, an affinity bias to people who are similar in that regard. In my social life, I probably spend more time with people who are like, who are more explorative or are able to experience things with like I like. You may see me more times with my foodie friends than my friends who are more conscious about their diets. Just the way it works. Perception bias. We have certainly stereotypes and assumptions about different groups. And we've seen that operate in our world from a political standpoint, from a national standpoint. We've seen that occur over time. After 9/11, in many instances, we had significant perception bias to people who were of Muslim religion or had the phenotypical or the appearance of someone who may be a national or a person of origin from the Middle East. Halo effect is certainly another unconscious bias that is prevalent and pervasive. We think of the people we idolize, right? I don't know how many of you may be Taylor Swift fans, but you have a halo effect for a person like Taylor Swift without even knowing her. Sometimes I see people operate in social media as though they're her next door neighbor or they've been her long lost cousin and friend. And Kristen is on the same wavelength. Kristen said, I was thinking of Taylor Swift. How funny. Absolutely. And then this confirmation bias, not a popular one. We have an initial perspective about things and we look for facts to confirm it. It's a natural instinct that we oftentimes have to learn how to change. And Kimberly, I like that. Thank you for sharing. Implicit bias with deep Southern accents. Absolutely. And yes, to some extent, it's certainly more, confirmation bias is extremely prevalent. Not necessarily more prevalent than the others, but in some instances, in some places, it certainly is more. But there's a great deal of unconscious bias or implicit biases and the types that you should probably spend some time getting to know better. And we have certainly the most common one, ageism, beauty bias. So these are biases that are both prevalent or pervasive in our personal and professional lives, and we need to be conscious and aware that they exist and know what they look like and sound like. And Lance asks, can you provide an example of a confirmation bias?
I was just going to say that. Thanks.
Okay, classic example. Confirmation bias. I look at the television often and I hear this concept that somehow Black men are treated negatively more often by the police than not. I'm driving, I was on my cell phone, and don't you dare share this. This is for this group. I'm just kidding, it's okay. Driving, cell phone in my hand, talking on my cell phone. New Jersey rules indicate that you can't be talking on your cell phone while you're holding and driving, right? You have to have some other listening device. I was literally in a state of hurry and I wasn't thinking. Police pulled me over. First thing I think, oh my God, I'm a Black man. He pulled me over. I'm going to jail. All this is going to happen. That was my first thought. I'm being honest with you. Cop pulled me over. First thing I heard his accent, I'm like, oh dear, he sounds like someone from, the South. I'm going under the jail here. That's my first thought. He said, sir, license, registration, the whole spiel. Then in 5 minutes, he said, it's obvious to me that you weren't, maliciously or intentionally thinking it. Looks like when you saw me, you put it away, so you're conscious. I'm going to give you a warning, but please understand the importance of this is not just a rule. It safeguards people's lives, and it's important for you to recognize that you could hurt yourself or hurt someone else, right? Please follow the rules. I'm gonna let you go. And that was my experience. My first experience of that manner. But my first thought was my confirmation bias, which is I was looking for a reason and looking for every single reason to confirm that somehow that cop was going to affirm to me that as a black man, I was going to be treated, with bias. I was going to go to jail. He was going to give me the worst consequence for a simple act of breaking the rules. Didn't happen. But that was my confirmation bias and overdrive. Does that make sense? Bravo. Great. And that was a great question. So there are many factors that contribute to implicit bias, and we've spoken about them earlier, from socialization and upbringing to media influence and representation, peer groups and societal norms, personal experiences and environments like mine, lots of contributing factors. But ultimately, what's important for us to note is, why does implicit bias matter? Why do we spend time talking about it and talking about interventions to address it? Implicit bias matters because it can unconsciously influence our perceptions, our decisions, and actions, and can lead to unequal treatment of people based on factors like race, gender, or age, even if we don't intend to discriminate, potentially creating disparities in so many areas of our personal and professional lives. Once again, without the individual being aware of their biased behavior. Why implicit bias matters is because it unconsciously shapes perception. It impacts attitude towards people, things, and circumstances. It influences decision-making. It can control our behavior, impede equity, and certainly affect outcomes for the people we serve or the people who are in our lives that are significant and dear to us. And Aaron says it correct, intent versus impact. In many instances, the impact may not necessarily align with our intent, but it happens. So it's important for us to know why we are spending time discussing this and getting a good handle on it, because it can impact the decisions we make, the perceptions we have, how we treat people, and the outcomes that the people we serve actually attain while under the influence of our actions, our decisions, our perceptions that may certainly be guided by those implicit biases. DJ says implicit bias like having a car that pulls to the left. We need to know it and use constant pressure to correct it. I like that. I'm going to steal that, DJ. That is a good one. So what's the harmful trajectory of implicit bias? And I alluded to that. Implicit bias oftentimes can lead to stereotyping, right? As we know, in the sense that it can oversimplify and create generalizations about a group of people, such as their race, ethnicity, age, appearance, sexual orientation, on and on and on. These stereotypes often can then project and create instances of prejudice. That attitude and feeling or opinion about the person or group based on their membership, people belonging to that group. After 9/11, every person who either professed to be Muslims or looked a certain way could have been perceived to be potential terrorists or people who are likely to do bad to others. And its prejudice is often based on misinformation about the group. It can be unjustifiable and harmful. Even if we've had instances of saying, hey, here's one example where that initial thought actually lent itself to a true act. It's only one instance and it can't be generalized. It should be generalized altogether as a truth and factoid. Oftentimes, when those prejudices are supported and fortified, they can lead to microaggression. Verbal or behavioral or environmental slights that are the results of an individual's implicit bias. And they occur oftentimes quite daily. They can be hostile, derogatory, or negative viewpoints about people, and can perpetuate certain perceptions. For example, a perception of white supremacy or straight privilege. Lots of instances where those things are unintentionally or intentionally harmful in some ways. And as we know, ultimately discrimination is the bugbear of it all, in that when we begin to use those initial perceptions, skewed as they may be, not just to inform our perceptions about people that belong to a group or to a category, but when we actually utilize that information to take away, to harm, or to discriminate against someone that belongs to that group simply because we have an initial perception about that group, not just its composition, but a sense of if you belong to that group, here's what this means. So it's important to recognize the potential trajectory of the implicit bias that may seem innocuous and not harmful. It can lead to stereotype, prejudice, microaggression, and discrimination. So there's a potential harsh and harmful consequence of implicit bias going unchecked. And we know microaggression comes in so many forms. How many of you have heard that question of, so like, what are you really, right? Are you American? Or someone basically saying, okay, you're saying Black Lives Matter, but all lives matter. So what does that mean to someone who is professing that Black Lives Matter? Or someone says, no. Where are you really from? How many of those are familiar to you? Aria says, I've heard that all the time as a person of color. And Ashley says, yes, happens to me all the time regarding what really are you? And that happens across the spectrum. You're really pretty for a ABCD. Or you speak rather well for a ABCD. I would have never thought you were disabled because of ABCD. Those are all microaggressions. Many versions of it. And even microaggressions can be further divided into categories. Micro-invalidations. Hearing someone being discriminated against and basically saying, I'm sure that that person didn't mean that. That person is a nice person. That person is a good Christian, a good Muslim or whatever. They would not say that about you. I think you misinterpreted it. Invalidating your reception of that person's stereotype or discriminatory behavior. Micro insults. Someone who may speak English as a second language being told, oh, your English is very good for a person from Vietnam, or whatever is very good. Oh, you dress very well for a person who is ABCD. Or you're not as flamboyant as most people who are gay, bisexual, whatever. Those are instances that we speak to. And Jeff says, experience them all professionally. Or micro assaults, right? Person who's speaking racist joke in your presence or discriminatory joke in someone's presence and assuming that, you're not going to be affected by it, or you shouldn't. You don't have the permission or the right to challenge it. So it's important to recognize what these are, what they mean, and how they can be harmful and prejudicial and discriminatory to people that are in our personal lives and also the people we serve on a professional basis. And there's lots of examples of implicit bias across the spectrum, right? We think of mental health services, for example. A clinician might unconsciously view certain racial or ethnic group as more prone to violence or less likely to follow treatment plans. Think of an example. Oh, we need to make sure that we have all, we do all this crisis planning for someone who has schizophrenia because they are more likely to A, B, C, D, E, F, G. Or the concept of someone who may be in recovery. People are making, as a clinician, assertions to the fact that there need to be some special clause or some special thing note in the assessment and the person has a history of substance use within this 25 years of recovery, and therefore we have to be careful that that person can't, live in a certain place, or they don't have the right to certain resources or services because they've had a history of substance use, without consciously being aware that that's prejudice and discriminatory in many ways. Even if we think it's paid with good intentions, it may still be an implicit bias that is lending itself to discriminatory behavior. Absolutely. Just about consciousness and awareness and the urge and the commitment and the responsibility to check your biases, check your implicit biases. Be aware and endorse the fact that we all have them, and we have to be vigilant and consciously aware that we need to be checking. In healthcare, medical staff may assume patients from certain backgrounds are exaggerating their symptoms, right? Leading to disparity in pain management or care recommendations. How many of you have a client who may be affected by substance use, go to a doctor, and automatically that physician assumes they're drug seeking because they have a history of substance use? And Marissa says all the time. Absolutely. Or the automatic assumption is that if a person has a depressive disorder, the first order of business is someone asking them, have you thought about hurting yourself in the last 2 hours? Implicit and prejudicial. Housing assistance. I think someone mentioned this earlier. Case managers can have conceptions about who's deserving of housing or housing assistance, and it may affect housing placement. Oh, this person has a history of eviction, and therefore, no, they should be third or fourth on the list, despite the time that has been gone by, the corrective action or remediation that person may have made. Yes, certainly. Physicians or clinicians, case managers, all of us, we're all prone to implicit bias, and if unchecked, can certainly result in discriminatory action, prejudicial action, microaggressions, or outright discrimination. In assessment, in service planning, in service provision, and in treatment. Someone says, as a recovering woman all of the time, also telling doctors that I don't want opioid and them telling me that you should have. Absolutely. So these are important awareness to bring to bear in our practice. What are the impact on behavioral health services? They are diverse and significant and profound in many instances. From misdiagnosis to treatment disparities to access to care being limited, curtailed, stigma perpetuation. And we have many instances and examples of this occurring pervasively throughout our service arena. It certainly can impact the quality of care patients receive, leading to disparities in diagnosis, treatment options, overall therapeutic outcomes. They're all very prevalent. Providers might interpret symptoms differently based on their implicit bias, right? Leading to inaccurate diagnosis for patients from marginalized groups. Someone's insistent that they're experiencing pain, if they have certain diagnosis or history, may be perceived and can be perceived and misconstrued in many ways, consciously or not, as delusional. So it's important for us to note, given that awareness, given that need for awareness, how do we combat implicit bias? How do we address them? And there's some clear and definitive ways of doing that. Mitigating your own implicit bias. It is important to exercise and practice introspection. Explore and identify your prejudices by taking the implicit association test. The more you know, if you understand clearly what implicit bias you are prone to, it is a lot more easier to recognize them, to endorse them, and then to address them in a way that helps you to engage more meaningfully and fact-driven and thoughtfully and compassionate. To be mindful, since you're more likely to give in to your biases under pressure, practice ways to reduce stress and increase mindfulness, such as good meditation, focused breathing. When you're stressed, when you're under pressure, you're more likely to engage in implicit bias because your brain is then being pushed to the limits to make quick judgments and categorizations. Learn to slow down.
We have a question.
Individuation.
Oh, I'm so sorry.
No, go right ahead.
There was a question about what survey or assessment were you speaking about when you were discussing introspection?
Okay, Harvard University and a number of its professionals created a test that I'm going to give you some information on at 2 slides ahead that really helps us to really get a good handle on our implicit bias. It helps us quickly categorize. It's similar to what I did in the first instance where I asked you in 10 seconds to make quick initial associations about certain things given certain images. So there's a comprehensive test that lends itself in that manner that really helps you understand what implicit bias you have and how they actually present themselves in your world. So you have some information to that implicit association test. But that's a very good question. Individuation is important as well as a way of really harnessing your awareness. Remember, evaluate people based on their characteristics rather than those affiliated with their group. This could include connecting over shared interests. So it's important to actually connect with people on that genuine, authentic basis and get to know them rather than just making us an assumption and association based on what you heard about that group. Check your messaging. Instead of saying things like, we don't see color, use statements that welcome and embrace multiculturalism or other differences. What you don't know in these instances can hurt you and others. Ignorance is not an excuse for discriminatory and stereotyping behaviors. Institutional fairness is important. We need to have that accountability from institution. And remember, it takes two. Or just take two. It's that movie Hollywood perspective, right? Overcoming unjust bias, it takes time. It is not something you can simply turn a switch on. You have to engage in some conscious, intentional practice. It's a lifelong process, and deprogramming your biases requires constant mindfulness and work. And I spoke about constant vigilance and constant mindfulness. It's a process, but your brain is a complex, malleable thing. It can actually move in that direction if you condition it, if you practice it to do so. Those same automatic assumptions can be informed. So recognizing your implicit bias, acknowledge your biases, then educate yourself to do better. The best place to start is to take the implicit association test so you really get a chance to consciously get to know and acknowledge your own implicit bias. So you're not operating from a place of ignorance, but a place of informed processing. Delve into the topic with Mahzarin Banaji's book, and we spoke about that earlier. I told you I was going to give you the title. It's Blind Spots, Hidden Biases of Good People. And it's on your list of references and resources at the end of the presentation. Be open to feedback. Let others challenge your assumptions. Embrace diverse perspective. Don't be afraid to be called out. Don't be afraid to have your perceptions challenged and your fact check. And Peter says, start with yourself is the best, I believe. Absolutely. First of all, recognize that you are not only prone to implicit bias, but you have them. They're part of who you are. They're part of how you exist and operate in the world. It's important to recognize them. And Veronica, I'm sorry to hear that, but thank you for sharing. Being Hispanic and English, my second language, is not easy. I've been treated differently. Absolutely. So have I. You know, it's funny because people always say you have an accent. And I'm like, I do? I assume everyone does. I think mine is different. But in different environments, the perception is different. Investigate your beliefs and assumptions. What core beliefs do you hold? How might these beliefs limit or enable you and your colleagues at work? How do you react to people from different backgrounds? These are important things to know. You have to ask the question to actually acknowledge that you may not know or you may not have consciously processed that before you react. Do your words and actions reflect your intentions? Can you put yourself in another person's shoes and empathize with their situation, even if you don't relate to it? Someone comes to you as a staff or a friend and says, I've experienced this. They didn't ask for your judgment or preconceptions or assumptions. They want you to hear. And then you ask them, how have you experienced that? What did that mean to you? How did that impact your life? Help me understand that. So it's really about working through that process with that person and going in with the intentions of understanding and learning and growing. There are many habits that you can practice for breaking bias. Take the intentional bias test, practice micro affirmations. Instead of going in the directions of microaggressions, think of the other perspective, right? Recognize hot buttons. If you know political subjects and political discourse brings out the worst in your implicit bias, you have to check yourself. You have to know that. You have to understand your triggers. And get comfortable with your own implicit bias. Spot on, DJ. Share it without shame, but take some action to address them. You can't just say, well, I have these implicit biases and that's how I'm going to operate in the world. So just give me grace. No, grace comes with work. You have to earn that grace. When a stereotypical response is detected, remind yourself of examples that prove that the stereotype to be inaccurate. Not all policemen actually treat black men poorly. No, that's not true in general, even if there are instances of that sort. It's not a generalization that you should make automatically. Be alert for explaining away bias. People do that more often. We all are oftentimes prone to do so. Classic example. Oh, they're a good person. They didn't mean anything by it. That's rationalization. You don't know what that person meant. And who gave you the authority to actually excuse away that behavior when another person is affected by it? Classic. When a person says, I'm not biased, but we have a clear and definitive way of saying anything that comes after but oftentimes refute what came before. Have you heard that before? But is the one conjunction that actually creates a problem. Absolutely. And I'm glad I'm not alone in this. I'm glad that people say, yes, I've heard it every time. When someone says that person's name is a bit hard to pronounce, I might not be able to remember it. In some instances, it may be true. In some instances, it can be racial or cultural bias. The person may simply not feel that they somehow, as an English-speaking person, should actually learn someone's name that may be of a different language, right? They don't have the grace and compassion to actually spend a minute learning something that's different. Or you've been in instances with your colleagues and someone says, oh, we just clicked on a personal level, so I feel more comfortable recommending that person for the job. That can be discriminatory, can be affinity bias. That person may have things in common does not mean that gives that person a leg up on the opportunity for promotion. It may in many ways be discriminatory to a person who is just as deserving or even more deserving. How to react when someone points out your microaggression. This is important to note. When someone points out your microaggression or your implicit bias, it's important for you to show some humility. A good example, a good way of intervening in that regard is by simply saying, I really appreciate you sharing that with me. What else did you notice that I should be aware of? Or I hadn't thought about it that way until you shared it with me. What would you say more? How can you help me fully understand how it impacted you by what I said? Thank you. I didn't realize that. I'm committed to addressing my unconscious biases. What else can you share with me about the impact of my actions? If there's anything you take away from today, these examples, I want you to use as good ways of actually demonstrating some humility and some openness to learning about yourself and how your behavior may impact other people. Your perception may impact other people. And the PDF will be shared with you. So and I know most of you, take a picture of it, take a screenshot of it, but we'll get it to you. So conscious decision making, and we're about to wrap up. We have 6 more minutes. I want to make sure we get this framework. Once we have that level of awareness, then we need to institute and practice conscious decision making to address the potential adverse impact of this implicit bias. And how do we do that? We certainly approach it from understanding what needs to be decided. There's some concrete strategies for conscious decision making. Gathering relevant information, considering all the options, weighing the pros and cons of each option, actively evaluating potential outcomes, taking time to reflect on what you're thinking before you say what comes to mind initially, consciously managing emotions before making a choice. If you're triggered, pause, slow down, think about the impact of what you're about to say or what you're about to do, and whether or not it aligns with your intentions and values. yes, it's important to take a look in the mirror, to Peter's point. So there are key elements of conscious decision making that is important to gather, and you can certainly look at the references and resources to gather them, but it's really figuring out, why am I reacting? Why am I thinking the way I think? Have I processed all the information? Have I fact-checked this? Am I conscious that what I'm about to say, how I'm about to react, really aligns with my values and principles? Is it really thoughtful and considerate of the other person's unique perspective, that person's intersectionality, that person's cultural identity? Am I being culturally responsive in the way I'm approaching this, thinking and processing and deciding? These are the hallmark of a person who is aware of their natural tendency to engage in implicit bias, and know that they need to check, they need to filter, they need to process, they need to constantly be vigilant about how it comes across and how it impacts others. Be aware that the phenomenon exists. We all experience implicit bias. We need to gather as much information about the things that we are unfamiliar with, or even the things that we think we know about people and groups, before we make generalizations and assumptions. We need to consider conflicting facts about what we may hear and what we may have experienced. And in many regards, we work as a team. We challenge each other, we confront each other, we share with each other, we inform each other, so that we're working collectively together to make our environment more diverse, more culturally conscious, more culturally responsive. We treat each other the way we want to be treated, and we think about what we're about to say, what we feel, what we do, and our behavior, knowing fully well that those initial processes that our brain experience does not necessarily lend itself to us acting in an egalitarian approach. It is not automatic because we think that we should do that, and therefore we're going to get the outcome that we desire, or the outcome that we intend to share with the person that we serve. Be aware and proactive in being more inclusive, right? Check your media biases. If you go to a specific site and you listen to only thing, you are actually conditioning your mind to think in that monolithical way. Learn how others experience the world. The more you know is important here. What are some of the ethical considerations of implicit bias? Justice and fairness, individual autonomy, beneficence, cultural competence, transparency and accountability, intersectionality, and unintended consequence. We have to be conscious that even if our intent is pure, our actions may not necessarily align with that based on our implicit bias. So here are some of the resources that I spoke to: unconscious bias, blind spot bias, and a lot of other resources. So if you have a minute, I certainly want to ask if you can identify any specific learning or practice experience that you want to take away from today's session. Because remember, our objective was to make sure that you have something to take away that helps you to further your understanding about implicit bias, your awareness, and help you pursue conscious decision-making in your actions each day. Thank you, Jody. Inspection, slow down, see a lot of takeaway. I'm glad that people have specific takeaways. And I want to thank you all. We appreciate your time and attention and participation. Today's webinar was hosted by DVHR through the Washington Healthcare Authority. And we'd like to remind you that the slides and a link to the recording of this session and a wealth of other resources will be available to you in the follow-up. And don't forget to check your Foundational Community Supports newsletter for all things FCS.
One last note, I am putting into the chat a link. You will see it highlighted in blue. This link is an anonymous satisfaction survey that allows you to provide your feedback to Earl and Rutgers on your experience for today's session. We strongly encourage that you go to that survey and fill it out so that you can provide your feedback in terms of today's session.
Thank you very much.
Thank you so much,
Once
Earl.
again,
It was such a
absolutely.
pleasure having you today and hearing you talk about this very important topic.
Appreciate it. Have a great rest of the evening and look forward to seeing you in our future sessions. Make sure you check us out.
Just gonna enter that link one more time in the chat. I see we still have a good amount of folks in here. Earl, is it okay if you stop the recording?